I'm going to be your student nurse today. My name is Raylyn. Can you tell me your name and how old you are?
Matthew, 7.
All right, I'm going to look at your wristband. All right, so I would wash my hands. I would provide privacy with a curtain or door. I just identified my patient. So you're here for a checkup, right? Today? All right, so I'm going to do an assessment. So patient looks to be age appropriate. He's dressed appropriate for the weather. His mood seems to be good, happy. He seems to have good hygiene, and he's alert and oriented ×3. So what I'm going to do first is I'm going to inspect your hair. Doesn't seem to be any, I'm just going to look in your hair, and doesn't seem to be any moles or anything. Does it hurt when I touch your head at all? No? Okay, good. All right, so, and then I'm gonna look at the face. Eyebrows, eyes, eyelashes, all seem to be symmetrical. Ears seem to be symmetrical and same size and age appropriate. And then can you do this for me? Just pull down a little bit underneath your eyes. Good. So conjunctiva, all right, you're good. You can let go. The conjunctiva and sclera, there seems to be no inflammation or drainage. And now I'm going to look in your ears. There seems to be no excess drainage on either side. Then I look in the nose. Seems to be no drainage or anything. Patency is good. And then lips seem to be symmetrical. Can you open your mouth for me? Good. So mucous membranes look to be pink, moist. Tongue protrusion is symmetrical. And then can you smile for me? Frown. And puff out your cheeks out. Puff your cheeks out. Good. All right, perfect. And then moving on. Can you follow this light for me? So I'm going to show a light and then just follow it with your eyes. Good. All right, and now lastly, I want you to do this for me. Can you flex your neck? Back, extend, side to side. Good. All right, so I'm going to move down to the arms. Arms look to be symmetrical. Fingernail distribution looks to be appropriate for age. Cap refill, 2+. All right, and then can you do flex your arms for me? Down, up, and then this. Go out, in, and then go out again. Does this hurt in here anywhere? No? All right.
No.
All right. Okay, so now what we're going to do, and then can you grip my fingers? Grip hard. Good. Perfect. Perfect. All right, so now I'm going to, if you can sit up for me. Thank you. So first I'm going to listen to lung sounds, but I'm just going to lift up your shirt a little bit. Looking at the skin distribution, looking to make sure there's no moles, no bruises, bumps, anything abnormal. And then for the anterior listening post, I would start above the clavicle down to the 6th to 10th or 6th to 8th rib, and then for the posterior side, I would start above the scapula down to the 10th or 12th rib. And so I'm going to listen real quick. So when I go to listen, I want you to take a deep breath in and out.
Okay.
Okay? I'm going to do the back side first, okay? Good. Good. And now the front. Good. lung sounds are clear bilaterally on the posterior and anterior side. And then one more time, I'm gonna have you sit up, sorry. So I'm gonna listen to the listening pulse. So it would be aortic, pulmonic, Erb's point, tricuspid valve, and then the mitral, which is where I will listen to the apical pulse as well. And then all right, so I'm gonna listen to your heart. Good. 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 All right. S1 and S2 are heard at Erb's point, and heart rate seems to be normal rhythm. And so now we're gonna go down. I'm gonna look at your chest. Do you mind if I lift up your shirt?
Fine.
Okay. So I'm looking at the chest. Do you have any problems with me touching your chest at all? Any chest tightness, anything?
No.
All right, and he seems to be in no respiratory distress at all. And then I'm going to inspect the abdomen. So there seems to be no distension or anything. Abdomen seems to be flat. And I'm going to listen to your bowel sounds. When's the last time you went to the bathroom? Had a bowel movement. So you went poop.
This morning.
Okay. And when was the last time you went to the bathroom just to void?
Right
To go
before
pee.
this.
Okay. Okay. All right. So I'm gonna listen to your bowel sounds. Good. Good. Skin turgor. Good. And then I'm gonna listen or feel. Does this hurt at all anywhere?
No.
No? All right. Then I'm gonna check down here. Palpate the bladder. Does it hurt at all?
No.
Down here? No? All right, okay. And now we're gonna move down. So you haven't had any trouble going to the bathroom? It's not hurting or anything? No? All right. So now we're gonna move down to the legs. Legs seem to be symmetrical. Distribution looks good. Does it hurt anywhere that I touch?
No.
No? All right, seem to be symmetrical. Can you flex your knee up? Like this? Yep. And then can you do this? Out to the side? Yep. Yeah. All right, you can sit back down. All right. And then for your feet, I'm gonna feel the pulses. So the posterior tibialis. Good, and then the dorsalis pedis. All right, and then capri fill time on the toes. 2+. All right, and then nail distribution. Oops, looks good for both toes and nails. All right, now lastly, this is the fun part. Are you ready? If I can get this back on, it's fine. All right, can you stand up for me? This is the fun part.
What?
Okay, let's go on the back, because I don't want you to hurt yourself, please. Pretty, please. Yeah, just on the floor. All right, can you jump up and down? All right, balance on one foot for 5 seconds. 1, 2, 3, 4, 5. Other one. 1, 2,
3, 4, 5.
All right, now can you skip to the wall? And then skip back. Good. All right, and then lastly, can you do this? Forward. Bend all the way down, looking for that scoliosis. And it seems to be good. And then coming up. Good. And I believe that's it. Balance on one foot. All right. Now you can sit back up on the bed. Thank you, sir. I appreciate it. You have a good day, okay?
Okay.
Knuckles? All right, now wash my hands and thank you for the cooperation and I'll document my findings.